All right. Hey, friends, it's Eric Malzone. I want to do a special introduction to this interview with Dr. Noura from 23andMe because this was recorded on January 17th of 2025. On March 23rd, 2025, just a few days before this publishes, there was an announcement at 23andMe that they are initiating voluntary Chapter 11 processes. So what does this mean? Well, they're a big brand. They've been around for a while. They're a pioneer in this space. But there's a lot of data, right? So what happens to all of that user data as they sell this off? And if you have used 23andMe in the past, I would urge you to go look at their website and find more information about how you can access and delete your data if you want. I would encourage you to do that. And it's going to be a very interesting case for us to follow because as wearable data and all this consumer wellness data and health data becomes more ubiquitous in the market, what do we do with all the data? And the privacy now has become front page news. So enjoy the interview, but please have that in mind and do a little bit of research and enjoy the conversation. Thank you. We are live. Dr. Noura, welcome to the Future of Fitness.
Thank you. I'm so happy to be here.
Yeah, what a treat. I get to record these on Friday morning, and I feel like by the weekend, I'm smarter than I was when I woke up on Friday. And, with someone like you on this show, the science of genomics, and you say genomics or genomics? How do you pronounce it?
Genomics.
Genomics. Okay.
Yes.
I'm already learning. There's a lot to talk about. Like, wow, like what a dynamic field to be in as far as technology and science. And as it starts to really become, available to so many more people, I was telling you prior to recording, I think within our industry, if you're going to be providing a really high level service for, precision wellness or, highly personalized fitness and wellness, like this is going to be table stakes very soon. And it's very exciting. And it's like the future that I thought was coming many years from now. It seems to be here now. So I don't know. We'll see where this takes us, but I have a lot of questions for you, doctor, is what I'm trying to say.
Yeah,
so
I completely agree. And I think, we have this conversation today, and if we talked again in a week or two, we'd be having a different conversation because it's such a rapidly evolving field.
Yeah, it's wild. Well, let's start with this. As I always do, I would love to hear your background, kind of how you got to be where you're at with 23andMe at a very senior high level position. And then we'll take it from there.
Yeah, so I'm Noura Abul-Husn. I am by background a physician scientist, an MD, PhD, who has spent a lot of my career really thinking about how do you bring scientific advances into clinical care. And I specialize in internal medicine and medical genetics. And so those are the fields that I really focus on, which are really adult medicine in general, and the field of genetics. And that is one that has been undergoing tremendous change. And that I think is really relevant to this conversation today, because even when I was training and thinking about medical genetics as a specialty, that was something that was relatively small, very specific use cases where genetic testing was being used to solve a problem, figuring out a diagnosis for a rare disease, mostly in children, some other interesting emerging utility in cancer, and just specific areas where genetics was making sense in the clinical world. Meanwhile, on the research and scientific side, advances in genomics, as we've been talking about, have just been increasingly coming out. And that science has just not even scratched the surface of being translated into human health and wellness. And so that's what makes me really excited. So I spend most of my career thinking about the interplay of genetics and health and where does this fit into the healthcare space. And then, and as part of that, spent a lot of time in the academic world, leading genomic medicine, most recently at Mount Sinai in New York City. And I've been at 23andMe for a couple of years now, thinking about this from a different lens and bringing genomic insights to millions of consumers has opened up an opportunity to really tell people what steps they can take using those insights to optimize their health and well-being. And that's my primary focus today.
Yeah, that is an interesting switch. I mean, you went from, no pun intended, very surgical approach in many ways, right? Like, hey, here's a specific problem. Let's see if we can solve it, to just this mass general. So when you say like looking at through a different lens, like how did you do that? Like how did you have to shift your mindset, the way you approach things, the way you digest information, what were the shifts in your practice in order to change the lens?
Yeah, when I started thinking about genetics and its space in medicine, we were at a point where genetic testing has been available for decades now, and you could really uncover certain truths using that type of technology. The technology advanced very quickly and the costs decreased very quickly. And then the research started to pick up because you're now able to apply genetic testing in spaces you never thought of before. And what I mean by that is that some of my research and many others since then was starting to show that if you took a population, a randomly selected population, and you screened them for genetic insights, you were going to find that every one of us has important genetic information pertaining to their health in some way. And we're just walking around with, our genes telling a story that would otherwise be uncovered, because that's not the way that the testing was applied in healthcare. And once I started to understand how much potential there was for genetic testing to uncover insights that could then be used to prevent disease, to keep people healthy, that became, that was my light bulb. Like, I wanted to do that. I want genetic testing and genomic data to benefit all people, because with that knowledge, you're empowered to stay healthy and to keep from getting sick. And so it really was that. It was all of these things happening in this space. And, the research that I was doing informing this type of population level screening that could enable preventive measures that were personalized to each human.
I love it. It's always been, this happens so much anecdotally, right? It's like you'll see like someone who's like 95 and, they drink a half a bottle of wine, and maybe they smoke cigarettes, or they smoke cigarettes for their whole life, but yet they're seemingly just doing great. Right. And then you see someone who did all the right things from a lifestyle factor, right? Like worked out all the time. And then, they end up croaking at age like 65, right? Or earlier. And it happens all the time. Everyone's like, it's just genetics. And we just say that, but we don't really know what that means. And now I feel like we're entering an age where like we can actually define very well, like why that may be happening, the nature versus nurture thing. Is it the lifestyle? Is it the genes and other factors? So I guess one of the big questions I have for you, doctor, is like, and you've already covered a bit of the past, but when you look at like the past and the present and the future of genomic testing for like consumer populations, like maybe walk us through a little bit, where it's at. And then the question I have for you now is kind of where do you think we're at in that spectrum of time?
Where it's at is that people understand that their genes, their genetics have meaning to them, whether it's to tell them about their ancestry or their relationships with other people or their health. I do think there's much more knowledge among the general population about our genetics. And I think 23andMe played a major role in that, in bringing complex data when it comes to genetic insights into the consumer world in a way that was very understandable. And we can now engage, at a cocktail party around our genetic information and share those insights in a way that you really couldn't 20 years ago. So there is that baseline knowledge. And so that starts to advance how it gets used, because like it or not, healthcare is going to be impacted by external pressures, including what consumers are interested in, what they've heard about. When you have genetics in the news all the time, and your patients, if you're a physician, are asking you, like, does this apply to me? Those are pressures that will influence how medicine is practiced. Yes. And so everything is related in many ways. We are not today in a place where every person is going to have access to a genetic test in healthcare. That's just not our reality today. I do think that is going to be our reality, and it's not far from now, where every one of us will have access to genetic testing because there is an understanding of the role that that plays in every person's life and how it can be used to improve health, optimize health, prevent disease, tailor treatment to improve health outcomes.
Yeah, I love it. Can you give us, Dr. Noura, maybe it's like a typical case of how genetics has influenced, an individual's life? Like just knowing the test, doing the testing, applying the right lifestyle changes, or just having the knowledge, how that's shifted someone's life.
I think I'll give two examples because I think the use cases are really different today. And, in healthcare, if someone has cancer, let's say breast cancer, they are recommended to get genetic testing. That's clinical genetic testing to understand, is there an underlying genetic reason for their cancer? And does that knowledge guide their next steps for treatment of cancer? And that is a type of precision medicine that is practiced, and it has shown to be beneficial. If I know, you have a type of breast cancer and that you are also someone with BRCA2 variant, BRCA variant that we sometimes say, I'm going to manage that cancer differently than I would otherwise. And so that type of knowledge is always increasing, and there are many examples of that. Now, I'll give a different example of someone who enters genetic testing not because they had a health problem to begin with, but because they are curious, because they are interested in being an active participant in their own health journey. And what that means is they want to consume knowledge. And we do live in a world where we have a lot of knowledge available to us. We wear smart watches and rings, and we have our smartphones and all of these things that are enabling us to consume a lot of data. And there are people who are more and more interested in that. And genetics really can play a big role in that picture. And so if you're someone who's curious about your health and you choose to purchase your own genetic testing kit to inform you about your health, you may find a host of things. And now this information is new. It's not new knowledge. You really perhaps had no reason to suspect that you were at elevated likelihood of prostate cancer because you don't have a family history of that, or of heart disease because that's just not on your mind because you're healthy and you're active and you're doing all the things, like you said, that you're meant to be doing to stay healthy. But then you're offered these insights. And what we can tell you now is that based on your genetic profile, for a host of common conditions, I mentioned heart disease, diabetes, kidney disease, others, whether you're at average likelihood as a general population to have that condition in your lifetime, or are you more likely to? And if you're more likely to, now that's still just data you're consuming. I don't know how helpful that is on its own. But what we've done, which I think is incredibly important, is tie that information with recommendations for what you should do next. And where the science is most exciting to me now is in that next phase of, okay, I can tell you all kinds of genetics related health information, but if that doesn't empower you to do something differently that's going to benefit your health, I don't think I've done my job yet. And so that's where we are now. And, you started off before the session talking about baseball innings, and I'm not a baseball person, but that's the next one. Are there four? I think there are four. That fourth inning is going to be synthesizing all of the information that genomics can bring, also putting together all the other data from biomarkers, from wearables, et cetera, and tying that to very clear, personalized recommendations that have personal benefit to each person.
Yeah, it's really interesting. As I've been in this line of work for a little while, we're in the what now phase, and I'll explain what I mean by that. Like, when wearable data first started coming out, people got their Fitbit, their Apple Watch, things like that. And as a gym owner and coach, people would come in and during our consultations be like, well, okay, this is great. What now? Like, what do I do with it? Right. I do this much step. This is sleep. But what's the context? Like what's the direction that I get? How does it become valuable? It was just kind of information, data thrown at consumers. And, I'm sure even in the early stages of genomic testing, when people just wanted to do it to find out like, am I part Native American? Like that was basically what most people wanted to know. Right. But the information wasn't contextual. But we're getting into this phase, even like I have my Oura Ring, and they do a really good job, I think, of how they take the data and make it presentable to people and make it useful and make suggestions in kind of a kind, gentle way as well. So I feel like that's where we're now. We're in this phase of like taking the data, make it contextual and individualized for each consumer. And it seems like that's where you guys are at too at 23andMe.
Yeah, that's exactly right. And this was a clear ask from customers. They were seeing all of this exciting new information and we're wondering, well, what do I do? Tell me what to do with that.
Right.
And the truth is, if you were going to take your genetic health reports to your primary care doctor, to doctors that who treat you who treat you when you're sick with a cold or whatnot, most physicians today don't know what to do with that type of genetic information because they haven't been trained to bring that into clinical decision making. And, I'm a trained medical geneticist. There are very few of us. And like I said, the field is kind of specialized in a different way of like, where does genetic testing add value? So what I'm talking about is now everyone having their genetic insights as part of their healthcare journey. And for that, you need expertise, you need personalized recommendations to be provided. So we do a lot of that at 23andMe, and that's part of the mission I feel very strongly about is expanding genomics knowledge across medical specialties, across all health and disease. In every person, every stage of their life, every demographic can benefit from genetic information as long as we know what it means, know how to interpret it, and use that interpretation to guide next steps.
So it feels like, if we talk about the baseball inning, like the inning that we're focusing on right now is how do we take high-end expertise that's generally contained within a human like yourself, right? I had a conversation recently with Dan Garner, who's doing Vitality Blueprint with Dr. Andy Galpin. Same thing. This guy's reviewed thousands of blood tests, right? So how do we take, very experienced, educated minds and now start to leverage that expertise across globally? And I presume that's the role of artificial intelligence, or more specifically algorithms. Maybe you can touch on that. Like, how is the technology driving the accessibility of expertise?
Yeah. And the beauty of the genomics world is that it has been intricately tied to machine learning, artificial intelligence for a long time, because by virtue of genomic data being massive amounts of data, we've had to learn to leverage those tools to make sense of it. And to be able to say, these are variants that are associated with this condition, but not this one. And to this extent, that type of research has always been leveraging AI technology. And so what that means is that we're ahead of the curve. We know how to already bring in the right tools to do something different, which is what you're talking about, to scale the knowledge. And a lot of it is really going to rely on what is out there in the world. What insights can we glean from clinical practice today? So what I mean by that is we already in healthcare use clinical risk to make decisions on who to screen for cancer, who to start on medication, at what point and at what frequency would you do those things? And so you can establish parallels when you understand the genetic risk results that data is showing us. You can say, well, based on this genetic profile, this person is at a certain elevated risk that matches a different type of clinical risk. Maybe it's based on weight or cholesterol levels. And we already use that to guide our decision making. can we apply that to the genetics now? And there's more and more of that coming. And, it's not just us. This is a very exciting field of research, like clinical genomics and translational genomics, really bringing the science into clinical care. So you can draw those parallels and you can make very smart decisions now based on genetics in the way that you would practice medicine prior to that.
Translational genomics. I like that. That's really, that struck me. So give us some insights, please, Doctor, on 23andMe, the total health. So that seems like that's the solution that you guys are putting in the market in its current form to address all of the, I guess, goals that you have that you talked about. So what's different about that? What's new about it?
What's new about it is a few things that we've touched on. Earlier, we talked about, can you screen a population for genetic insights that would help them optimize their health, live longer, healthier lives? And that really forms the basis of total health. So we have a sequencing test that queries genes that are known to be actionable in somebody's genome. And what that means is that those are genes that are known to be linked to health conditions for which there are available interventions today to reduce your risk of ever having that disease, or to help us detect it as early as possible in order to tailor and manage that disease to our best extent and realize the best outcomes for a person. And so that really is the new and exciting part of total health, is navigating somebody's genome in a way that's going to screen them for things that are actionable. Now, this already sits on top of all of the other insights that 23andMe has been providing. For example, those elevated likelihoods for common diseases that we can draw insights around. And then, in addition to that, total health customers will have access to advanced cardiometabolic testing, lab tests that are enabling us to tell someone what their status is today. Your DNA or germline genetic information is telling us your roadmap of your life. It's the blueprint. And then what I want to know is, where are you at today? Is your cholesterol high? Are these other biomarkers out of place? We use those biomarkers to also inform on your biological age. That's a very interesting, relatively new concept. It's telling us, we all have a chronological age. Are your organs telling a different story? Is your biological age younger or older than your chronological age? And if it's older, why is that? Is it your liver? Should we be paying special attention to your cardiovascular health? Those are very exciting insights. And when we have our own model to develop those, and now we can tell people where, you're 40, but your biological age is telling us that you're 47. These are the liver enzymes that are out of range, and maybe we should focus some attention on how to bring that back. And then all of this, so how do you navigate all of that information? I mentioned also that you need expertise. And so we have a medical group that has specific, unique training in genetics. And it's not about being a medical geneticist. It's about bringing genetics into clinical decision-making, using genetics to inform next steps and personalized recommendations. And that access to expertise is unique because it is really hard to find in the traditional healthcare world.
Oh yeah, it absolutely is. And so walk me through the customer experience here. So I go to the website 23andme.com/total-health, right? I'm looking at it. I sign up. Like what happens next? What's the phases of the journey?
Phase one is you get a saliva kit sent to your home, and that's how we do genetic testing. It's based on saliva. So you spit into a tube, you package it up and mail it. And then it's amazing. And then you start to get your results. And you, like I mentioned, we have an exome sequencing test as part of Total Health. So that is something that only Total Health customers will have access to. That's going to really query a set of genes that are very actionable and important to have knowledge about. And then all of the other insights, including about your genetic weight, your muscle composition, your propensity towards heart disease and diabetes, and all of the things that 23andMe has to offer. You get those insights, you get access to blood labs. So you have to schedule a blood draw at a phlebotomy center to get those labs. as part of that picture. And then you get a consultation with a clinical expert. And those are the clinicians that I mentioned who have been specifically trained to provide genomics-informed care. And that consultation can be relatively long for some people because there's a lot to digest. And so the goal is to provide each customer with a comprehensive risk assessment. Take all of those different inputs from the genetics, from the blood biomarkers, your biological age, your personal and family history, and then give you that risk assessment. Tied to it, very importantly, your personalized prevention plan. The goal of this program is to enable customers to be those active participants in their own health journey. And that is primarily a prevention journey. As much as possible, we want to catch people before they're sick and prevent you from getting sick in the first place wherever we can. And so that's really that there's a lot that happens in a few short weeks. And then there is continuous access to those clinicians with any questions, anything that comes up. You do labs again 6 months later. Again, we want to see, do your biomarkers change? Does your biological age change based on changes that you've made in your lifestyle or anything else that's been recommended? And you continue that journey.
Got it. So this is it's a nice blend of product and service that you guys are providing for the consumer. And is it ongoing? Like after the initial phase that you invest in, is it a subscription that kind of moves forward, then you have ongoing access? Is that the way it works?
Yes, exactly. Exactly. And this is, again, an area that's so evolving. And what I do, what my team does is really keep an eye on the science, that translational genomics lens. We want to know, when are there new insights we can bring into the product? And so we were continuously developing new health reports that we put out, and those customers benefit from those, the new knowledge that's gained.
Yeah, awesome. Asking as like an advocate for, the fitness and wellness industry, not necessarily healthcare. The things that get me excited about this is like, it allows us to work outside of scope of practice to benefit from, really specific insights that our clients maybe want to invest in. Now, let me rephrase this question. So right now, the big buzz within the fitness industry is that, we're starting to be positioned at the forefront of healthcare. Like we can have a lot more conversations with our clients. I mean, we have a lot of people coming through our doors at health clubs and gyms and, online coaching and programming and things like that. Like we talk to people about their general health probably more than anybody really. And we're just starting to realize like, wow, there's actually a lot of opportunity there. How do you see, or have you thought about how the gym, health club, coaching industry, trainer industry can really start to position themselves at the forefront of healthcare using tools like this? Do you think it's possible? Is it doable? Are we chasing the right thing?
I do. I absolutely do. What's so interesting about how we interact with healthcare today is that, if you're somebody who wants to focus on staying healthy, staying fit, preventing disease, living longer, it's really on you as an individual. And, your gym membership, you're paying for it. Well, maybe some lucky people have their employers who are providing that. It's not part of your health plan. And that's because healthcare is designed to manage illness, to treat people who are sick. And that's a major focus of traditional healthcare today. So anything that's upstream of that, that's focusing on prevention and health and wellness is today, unfortunately, mostly the individual's, not problem, but opportunity to solve on their own. So I'm not surprised when you say that you're having more conversations with people about their health than anyone else, because that's, by design, that's how healthcare is. If they're not suffering from an acute illness or a chronic condition that needs to be managed, and they really want to talk about nutrition and fitness and, other health and wellness opportunities, there's not a huge place for that yet in traditional healthcare. So can genetics and genomics be brought into the picture? Absolutely, because what we can do today, which makes me really excited, is now use an interplay between genomics and lifestyle data to start to be a lot more specific about how your lifestyle changes, which lifestyle changes are going to be best for you. And what I mean by that is we know there's more and more published data on this, that for someone with a certain genetic risk profile versus others, if we look at weight, that a greater number of steps are going to be needed to either maintain weight or lose weight for someone based on their genes. How do you start to translate that into insight? So we started to do that. And for example, I am somebody whose genetic weight profile shows that I am most likely to benefit from maintaining a certain level of activity and not being sedentary than other interventions like nutrition or exercise. I mean, those things are all important, right? But if I wanted to pick one thing, it's January, people are still working on resolutions. So if I wanted to pick a resolution to start off 2025, maybe it should be stand up more. Use that standing desk of yours. And I'm often on these calls. And so that's in my mind because I have now understood that I am somebody based on my genetics, based on data from millions of people like me who've had different lifestyles. I can tell people what would work best for them. And that is extremely powerful because telling people that they should eat better and exercise more, it doesn't work. And there's a lot of, feeling of trials and resolutions that end up in failure. So how do we give tangible, informed decision-making opportunities to people?
Yeah. I mean, this time of year, Dr. Noura, for the fitness industry is, it's exciting and also bewildering at the same time. It's like we get all these people coming in and then we see them kind of die off in the next month. And every year, yet we have to be prepared for the push, right? And we have to, we have to have everything lined up because they're coming. But then they kind of and it seems to get I don't know, every year I was in the gym industry, it seemed to get pushed back a little bit later every year. It used to be January 4th, boom, right? And then it turned to second week of January. Then it was it's the first week of February is kind of but anyway, I digress. I think it's super interesting. And what from my industry perspective too, is that when you start off a relationship with a client with this type of data, this type of personalization, it completely changes the dynamic of the relationship because you're sitting down, right? You're looking over things that are objective, qualitative or quantitative, right? And you can sit there and have a different kind of conversation besides Dr. Noura, I'm Eric, I'm the expert. This is what you're going to do, right? No, you sit down and be like, hey, this is you, Dr. Noura. This is your profile and we're going to work with it and it's going to be personalized and we can check back on it and we're a team here, right? This is our blueprint. And I think that's really important, not just from the data and the capabilities of what we can do, but how we work with clients that walk in our doors. I think it's a really, really valuable thing. And
I agree. I think health is a partnership, wellness is a partnership. And I said this before, if I can achieve someone's ability to feel like they are truly a shared participant in their own health journey because they are empowered with this knowledge, I feel like I've done something really good.
Yeah. Yeah. Well said. Perfectly said. I want to know, and you may not have a formulated opinion on this yet, but I'm going to ask you since I got you. GLP-1s in that whole category. Have you formulated an opinion? Is it good? Is it bad? Is it somewhere in the middle? Where are you with that? Because our industry tends to get really excited about it at first, and then of course very polarized about it. I tend to oscillate back and forth between whether it's good or bad. It's a couple things that fundamentally irk me about it, but I see potential. But I also know that human behavior is really hard to change. I don't think because someone's taking a shot, they're all of a sudden going to walk in the gym and want to lift a bunch of weights and do all the fitnessy things, right? So for you personally, how do you feel about GLP-1s right now at this phase? Are you optimistic? Are you concerned? Both?
I don't think it's super binary for me. I'm more optimistic than anything else. I do think what has changed a lot, which I am grateful and happy to see is that there's a shift from, the blame game. And I would say like that's really important. People feeling disempowered is never going to be helpful to them. And so we're offering more options to deal with a condition, obesity or being overweight. And that's amazing. That's really, really important. I always say the same thing about genetics, like don't blame your genes, know your genes and understand what they have to say about you, but don't blame them because it's not useful to do that. So with GLP-1s, we're in a very interesting and exciting phase where we've seen that these are medications that can really do a lot. And I don't just mean when it comes to weight, like there's emerging evidence that these might be wonder drugs that are going to help prevent all kinds of other conditions, weight-related or not. I think time will tell. The science is really very, very exciting, very fast-moving. We don't know a lot about genomics and its role in GLP-1s. And, I've spoken with physicians who are experts in obesity medicine who are prescribing GLP-1s, and they'll say, I have patients and you see the weight disappear and it's amazing how quickly it works and they can maintain it. And then you have someone who looks the same to me, same weight profile, maybe same demographics, and doesn't work for them. And wouldn't it be nice to know and to be able to understand what is going to work, what dosing is going to work, and for how long? How do you take people off the medication? Can you? So many unanswered questions. I do think the genomics, that genomics is going to inform some of these, not everything, but there is a role for genomics in understanding this world of GLP-1s as well.
Yeah. Yeah, well said. It's really interesting insights, especially coming from the kind of the purview of genetics, right, and how those two interplay. I've never quite heard that angle before. Really interesting.
I think one thing, and we're doing research on this. It's early days, but I think we're going to find a lot of interesting things. And my goal with that is really going to be how to improve how we use these incredible medications moving forward.
Yeah, awesome. I think with genetics and any kind of very powerful piece of technology coming down the pipe, there's also things that people are concerned about, right? I know data security is a big one. Like, where's my genetic data going? Like, what are people going to be able to use it with? That's one. But I guess you personally, is there anything about the fast progression of this technology in this world that you're in genomics that gives you a little bit of pause? Is there any concerns that you have that maybe it could be misused or anything like that, like in non-good players' hands?
Yeah, I think, data privacy is extremely important, and considerations around that are always going to be top of mind. We live in a data world. We are constantly sharing information, and there are bad actors that could potentially be out there to misuse it. So how do we offer the most rigorous data privacy and security measures? And that's something that we think about all the time and are really very committed to. Misuse of genomic information, when I think about it more from a health perspective, it's about misunderstanding genomics. And I think there's still a lot of education that's needed, both to the lay public and to consumers, but also to the medical world, so that everyone is really using the right terminology. And when we talk about genetics, there used to be an understanding that your genes were deterministic, that, when you have a finding that is an absolute, it is binary, you will have, a condition at the end of it. We know so much more now, and there's really all these different shades and nuances that enable us to understand genetic health information in a different way. And part of what I would love to make sure happens is that there's more education around that, so that people do know that when they find out something about their genome, that it's not that black and white. It doesn't mean you are going to have cancer. For the most part, I mean, there are exceptions to that, but for the most part, there are things that you can do. And so having that knowledge firsthand, I think is really empowering.
Yeah, great answer. So this is a fun one I like to ask towards the end of interviews, but I guess I'll restrict it to a certain age group, like people under 50, myself, barely get in the gear. I presume you're significantly younger than me. If we play our cards right, we leverage the technologies available, we manage our lifestyle, how long do you think we can have a solid health span into the future? I've heard some people in the show say 130, right? Maybe longer. I've heard that, in the next 5 to 10 years, we're going to have astronomical breakthroughs in longevity science. Like, what do you think? What would you bet on if you're a betting person?
I think if I were a better betting person, I do think we are going to see an increase in lifespan and health span. I mean, health span to me is much more important. Who wants to live an extra 20 years but be unhealthy and sick and all of those things? That's not ideal. You want quality of life too. So, are we going to see that change in 10 years? Unlikely to see significant changes, but is the next generation, are our kids going to live to be 100 and above that? I think that's entirely possible. What makes me really excited is there is this focus more on prevention, and prevention is tied very tightly to health span, right? And you hear a lot of people talking about this now, and I think that longevity is one buzzword, but really the way we should be thinking about it is that healthy optimization of life. And it's not, I love, obviously, genetics and genomics. I love that. It means a lot to me. It's not all about that. What I'm very excited about is to see us focusing on exposures more too, and what are unhealthy exposures that we should be really trying to eliminate from our futures, from our children's futures. And I think that that's going to make a huge difference in, processed foods and plastics and things like that. Those are all key. So I'm hopeful. I'm optimistic. I'll say 100. In our lifetime, I think we could see people like getting closer to that. And our kids, is it 120? Yeah, maybe.
Crazy, right? Crazy. The future is now. Doctor, thank you so much for joining me. The last question I always ask is, how can we help you as an industry? And what I mean by that is, if people are going to reach out to you, want to connect with you, what would you like to hear from them about? What's most important? What are the challenges we can help with?
One of the things, I love that question. I do think I love to read our customer care, feedback from customers. And people ask about specific things like, do you have a report on this gene, on this health condition? If there are things that are interesting, let us know, because there are people like me and folks on my team who are looking at that. And sometimes we're like, could we do that? Let's look in our data. Is there something genetic to say about this? We're always looking for more to do and try to be really responsive to our customers. And so absolutely reach out and tell us what you'd like to see more of.
And what's the best place for people to get to you?
If you go to 23andme.com and want to do what I just said, there's a customer care link that's very easy to navigate.
Okay.
So that's probably the easiest. We also have, you can also see 23andMe on social media and certainly reach out that way.
Yeah. Well, thank you for joining me. This has been very enlightening. Like I said, I over the last 45 minutes, I think I got a tiny bit smarter, maybe. But it's been an absolute pleasure. And if there's anything we can do as an industry, just let me know. And ladies and gentlemen, Dr. Noura.
Thank you so much, Eric.